All right. Are we good to go, Yamini? Yamini, are we good
Yes,
to go?
Anjali, please proceed.
All right. So it's a bright Sunday morning, and welcome each and every one of you. So, good morning, and a very warm welcome to our esteemed guests and participants. Now, our mental health determines how we think, feel, and act. And in the past 2 years, we have realized how important it is to keep a mental well being as well as prioritize our physical well being. Our childhood and adolescence have been critical stages of life for mental health. Rapid growth and development take place in the brain, and that is when the children and adolescents acquire cognitive and social emotional skills. And that is how we shape our mental health and assume adult roles in the society. Where every experience teaches us something, early in adolescence, we learn to regulate our emotions, manage expectations, and navigate challenges. As we age, we gain maturity, confidence, and ability to handle challenges. And this maturity becomes essential for success in adult life.
I think Anjali has lost a connection.
I know.
I was wondering if it was my connection. I was just going to drop a chat.
No, no, no. It is, I think,
Okay.
Anjali has lost his connection.
Okay.
Yes, yes.
Okay.
Hmm. As the Anjali has lost his connection, I'll create the background of this event that has been organized in joint collaboration with Adolescent Health Academy Ahmedabad, UNICEF Gujarat, Gujarat Youth Forum, Elixir Foundation, and UA. Actually, in current scenario, if we see the demography of the world, 1 in 6 people are aged 10 to 19, indicating that the young generation dominates much of the global landscape. The age of adolescence is unique. They are not considered as a child, they are not considered as an adult, but it is a very formative age during which their physical, emotional, psychological, and career wise development is happening. So it is a very crucial age between 11 to 18, or we can say 10 to 25, the youth. They have been going through a huge physical changes, emotional changes, social changes, and this is also a time of great vulnerabilities. They have lot of exposure. Many teenagers have exposed to poverty, abuse, violence, as well as the current era of pandemic leading to lockdowns, increased online studies, social distancing, societal changes which is also affecting their mental and physical development. We have been really seeing a huge surge into mental health issues of children and adolescents in past 2 years. And as the pandemic is coming almost to its end, schools are reopening, the schedules of children and adolescents are changing. I hope I'm not right in saying that, but there is going to be a huge increase in these mental health issues in children and adolescents. And we have to be prepared to take care of these issues. As being pediatrician, we believe more of preventing rather than treating any issues. So let us create a pool of people with the help of various stakeholders who take charge of this mental health of the children and the adolescent and start creating awareness about all these issues so that we can work together in the collaboration with each other and create a concrete roadmap to make the world teenager friendly, which is my motto or the passion of life. And I'm working things in a big way. If we see the mental health issues of adolescent, globally 1 in 7 10 to 19-year-olds experience a mental disorder, according for 13% of global burden of disease in this age group. Depression, anxiety, behavioral disorders are among the leading causes of illness and disability among adolescents. Suicide is the fourth leading cause of death among 15 to 19 years old, the peak of their life, and they are taking away their life. The consequences of failing to address adolescence mental health conditions extend to adulthood, impairing both physical and mental health and limiting opportunities to lead fulfilling lives and as an adult. And as the government is also focusing on the life cycle approach of the individual, teenager becomes the very focus point for everyone as far as their physical health is concerned and the mental health is concerned. I am really inviting all of you to join this movement and create an amazing work for next 1 to 2 years to create a path so that we can take care of the health of these children. The third week of the March, that is starting from 20th March to 26th March, is celebrated as International Adolescent Health Week. And there is going to be many awareness activity happening across the globe. Light lime color is the theme for this. Transition from childhood to adulthood is the theme for this year's Adolescent Healthcare Week. And we, as Adolescent Health Academy Ahmedabad, is also planning many activities. I invite Gujarat Youth Forum, Elixir Foundation, Yuva, UNICEF, as well as the Ministry of Health and Family Welfare and WCD, Ahmedabad Municipal Corporation, to join hand in this movement. And we would like to end this week with an adolescent health conclave where we will bring all the stakeholders in one platform and we can think, talk, and create the future roadmap on 26th and 27th. So I invite all of you to join hands in this movement also, and we can definitely make a huge difference. Today, there is going to be 3 workshops lined one after another, and all the mental health experts who are working in the Gujarat related to adolescent health have joined this movement. And I'm really looking forward for all these 3 workshops. And I request all the participants to stay till the end so you can get the crux. And we want to create leaders out of this workshop so that whenever it is required that you can support the movement of mental health in Ahmedabad, Gujarat, and in India and going forward towards the world. So thank you so much for inviting me for this workshop and inaugural session. And I welcome you all to continue for this workshop today. Thank you so much.
Thank you so much, sir, for your esteemed pointers that you have shared with respect to mental health and mental health related to which is one of the most important topics for today. Followed by we have Dr. Sravan Chenji, who is the health officer at UNICEF Gujarat. Dr. Chenji is a public health expert who is working in UNICEF Gujarat as the health officer, technically supporting the state for improving the health of mothers and children. He's part of UNICEF team, which has been engaged in the government of Gujarat in strengthening the COVID-19 response and COVID vaccination campaign. An alumnus of Kasturba Medical College, Manipal, with an MD in preventive and social medicine, he has a rich experience in working with various state governments and UN agencies in states like Karnataka, Telangana, and Gujarat in the past areas of maternal and child health, immunization, and COVID response. So I'd like you to share your few pointers with related to this. Thank you so much for joining in.
Yeah. Thank you, Anjali. Good morning, everybody. So, like Dr. Nishchal has already given a brief overview of what is the significance of mental health in children. And what I would like to request your focus to be upon is the impact of what the COVID 19 pandemic has had on the mental health of children as well as the parents. We all had known that during the first and second waves, due to the specific situations of the lockdown and the travel restrictions, there were several families which could not move out of their home. All the schools were closed, the Anganwadi centers were closed, the children could not go out. There was no social interaction. They could not play with each other. They could not meet their friends. They could not meet their educational requirements. And if we talk about the vulnerable sections of the society, this was the most affected. When we talk about the urban slums, the vulnerable groups such as the tribals, the migrant groups, many of them, thousands of them have lost jobs during the lockdown. And whenever these families lose jobs, it automatically has a significant impact on the children as well. When the parents lose their jobs, the children in many scenarios are forced into child labor because the family has to meet their daily needs and requirements. The children cannot go to school anymore. Some of them are confined to the home. There is no education, and there is a higher risk of domestic violence, especially in the vulnerable groups and also in many of the urban pockets. So because of all these environment changes in the scenario and environment around children, there was a significant impact on the mental health of children and adolescents starting from the first wave of COVID, and I can say that it is still even continuing now. But there is still a ray of hope because we all now know that schools are being reopened across the country. Even in Gujarat, the schools have reopened completely. And good news is that Anganwadi centers have also reopened. So we can now hope that children would resume their education, and the digital divide, which was actually not allowing access to proper online education to children living in the vulnerable groups such as tribal areas, migrants, and rural areas. So that also could be overcome now because with the school reopening. But it is very important for us to understand that specifically during the COVID 19 pandemic, because of the confinement at home, there was an exaggerated screen time for children. And we can all agree that because of this particular exposure to excessive amount of screen time, the level of interaction, the level of social interaction was reduced, the physical activity in children was reduced. And I myself have a 3.5-year-old daughter, and in the past 2 years she indeed has gone through a lot of difficulties because of no significant social interaction with other children. And I urge that we need to protect this generation who have been significantly impacted during the COVID 19 pandemic and who may be suffering with mental health issues like stress, anxiety, isolation from the other social interaction. So we need to understand what issues the children are going through because adolescents may express that they are going through some problems, but children most of the time will not even be able to express what mental health issues they are going through. So it is important for the parents to understand what problems the child might be having. And it is important for the parents to understand to seek healthcare from a pediatrician or a psychologist or a psychiatrist whenever the need is there. So, from UNICEF, what have we been doing to strengthen the mental health interventions for children? During the second wave of the COVID 19 pandemic itself, we had tried to develop few interventions along with the State Mental Health Authority of Gujarat, wherein we had tried to develop a manual on ensuring safety and well being during COVID 19 pandemic, with which we tried to train the healthcare workers and frontline workers so that the mental health in the community can be improved. We have also developed a manual together with State Health Mental Authority on psychological first aid during disasters because we realized that COVID-19 pandemic is an example of a disaster and similar disasters may come in the future as well. And we need to be prepared. We should not be thinking what to do after the damage has happened. And for this, it is very important for the healthcare workers and frontline workers to understand how psychological first aid has to be given in case of a disaster similar to COVID 19. So we have developed that module as well. And with the help of State Mental Health Authority, Many trainings have already happened in which they have trained the healthcare workers and frontline workers in this particular component. We have also developed 10 awareness generation videos focusing on COVID 19 and its impact on mental health, specifically on children, which can be used on various platforms to raise awareness about what is the impact and what we need to do to protect the mental health of children. So these are just, it is just a beginning. And these efforts, how Dr. Nishchal Bhatt has conveyed, we need to continue these efforts because we need to protect and save our generation of children who have been significantly affected by COVID 19. I can say for sure with confidence that not only parents but the children are the ones who are the most affected during the COVID 19 pandemic because they have a life ahead of them, which, if we don't intervene now, they will not be able to live happily as we had done in our childhood. All the very best to the panel for the day long workshop. Thank you.
Thank you so much, Dr. Chenji, for giving your valuable informations and insights with respect to this. I absolutely agree that it's the efforts that will always be fruitful at the end of the day, and working towards mental health has always been the core idea with respect to our association. And followed by, now I'd like to introduce Sharmila Ray. Sharmila Ray is the protection specialist in UNICEF Gujarat. She works with government and non government partners to ensure that children stay protected from different forms of violence, and there is a strong focus both in policy and practice to ensure that the children might stay safe from any form of abuse, exploitation, and neglect, including child labor and child marriage. Sharmila ma'am has also worked intensively in these issues in Gujarat, Bihar, and Rajasthan. Ma'am, over to you. Please share with us your valuable insights on mental health.
Thanks. Thanks, Anjali. Am I audible?
Yes, ma'am, you're way on.
Right.
Clear.
Okay.
Now
Thanks.
it's clear.
A very good morning, everybody. It's a pleasure to be speaking at the inaugural of Mental Health Matters with my esteemed co-panelists, Dr. Nishchal Bhatt, Chairperson of the Adolescent Health Academy, Ahmedabad, my colleague, Dr. Sravan, who works with me at UNICEF, Nishra, who is a very young, very articulate and dynamic mental health advocate and shares her experiences around mental health, the ups and the downs in very courageous ways. So thank you, all of you, and a very warm welcome. The day is action-packed. When I see the itinerary, and it's full of very interesting sessions, and I especially appreciate the fact that when you see the way in which the sessions have been designed, we are now moving away from the broader hows and whys of mental health into actually breaking it down to talk about how is it that how do we interact with our own mental health and those with our beloveds and our friends and families inside the house, on our mobile phones, how do interpersonal relationships affect it. So now we are actually talking about the nitty-gritties and details, ways in which we can help others in the way in which we behave with them rather than just in terms of a knowledge transaction. And I think that's a very important step. And it does signify the fact that we are definitely moving ahead in the right direction in terms of also acknowledging that it's there. And now we're talking about the nitty-gritties and the nuts and bolts of how do we identify, how do we help, how are we part of this movement. So for that, I would like to congratulate everybody who's involved in the state towards building this very positive momentum. Just a quick step back. So when we talk about mental health, we're talking about our emotional, our psychological, our social well-being. It affects how we think, it affects how we act, it affects how we feel. It's very, very integral to our overall well-being, therefore, and our ability, quote unquote, to function. And I think now that we have come to this stage where we're talking about the nuts and bolts of how we work through this situation and this issue, I think the first important step is acceptance, which is acceptance without any associations of fear and shame or taboo. A few days back, I was watching this very interesting clip by Kapil Sharma. Most of you would be aware of him. He's like a household name. And he talks about how he went to his therapist because he was having some trouble. and his therapist told him that she had been practicing for 40 years. And he makes a very interesting quip to say that, but mental health has been around only for the last 15 years. What was she doing 25 years before that? And I think that's a very interesting segue into the fact that we think, and it's a very humorous way to talk about a very important point, which is that mental health has been around. It has been around for generations. It's not a new age issue that today's kids talk about, and it's a finger pointed at how our resilience is breaking down. And in the older times, we were much better at handling it. No, that's not true. It was something that went unacknowledged. And I think it's very important to accept and acknowledge that it has been around and has affected our previous generations as well. That's a very important step, and we need to talk about that. Second, that it might sometimes manifest in overt ways, of course. From the outside of a person, you sort of figure that there might be issues that one needs to address, but it is not always that. There are times that we might, just an absence of symptoms to an outsider does not negate the fact that a mental health condition might be there. So that's the second step that we need to sort of move towards, and we need to acknowledge and address that. We need to talk about it more. हमें नहीं दिखता इसका मतलब ये नहीं है that the other person doesn't have a situation. It does not give us the right to say it looks fine, I'm sure you're okay. No, it doesn't mean you're okay. If somebody says they have a problem, we need to listen. More people pretend to be okay than they pretend to be depressed. So that's something that we need to acknowledge and talk about. The condition itself is a spectrum. That's the third bit. It's a spectrum. For example, I might have a mild headache. It might not make me debilitated. It might not interfere with my functioning, but it's still an inconvenience. It might also be a severe headache. It's a spectrum. Similarly, with mental health, some things are okay with self-care and talking to a trusted adult or seeking counsel with friends, but some things definitely require more serious medical intervention. So it's an entire spectrum, and we need to acknowledge that not everything is put in one basket. Fourth, and Dr. Sravan and Dr. Bhatt also touched upon it very articulately, so I won't go into the details, is that a lot of the times it is triggered by our immediate reality, by our lived conditions. So, for example, COVID-induced stress, COVID-induced loneliness has definitely increased the need for mental health, both in terms of demand as well as supply. Adolescents, especially, their lives have changed so fast that before they could adapt to it, they've had to sort of, I mean, it's also a breakdown in your response mechanism. So it's also very, very triggered and situational, which is why we are talking about COVID-induced concerns. And I'm not going to touch upon it because it's been very well articulated and elaborated upon by Dr. Sravan and Dr. Bhatt. It is important, therefore, that we identify our circle of trusted adults, people that we seek counsel from, people that we seek guidance from. And while the world around us changes, especially the changes that are technology driven, and we are adapting fast at sort of hanging on to these new changes and being with it, it is also very, very important to be aware of the pitfalls of these new kind of behaviors and innovations and access that we have now. It's very important to keep ourselves educated at all times, especially adolescents and young people. As you go forth into the world, a lot of the new experiences are very new for you. Like, it's the first time you're going to face it. So unless you stay educated and unless you're informed about what the challenges might be along with the benefits, it might be an area of confusion leading to more stress. At UNICEF, again, Sravan has outlined this quite beautifully, but more or less, just broadly speaking, we work with youth groups, we work with government departments, especially health, social justice, women and child development. We work with adolescents, we work in schools, so the Department of Education is involved. We are also working with different CSO and NGO partners. We work with institutes, associations to ensure that broadly, again, that we work both on the demand side of it, so there's no stigma. People are able to demand these services, seek these services, talk about these issues, that some of these age-old taboos start hopefully cracking. We also look at the supply side of it. So in terms of the services one can provide from a professional point of view, both government as well as private. We also work around, while we talk about supply and we talk about demand, we also work around building acceptance around both. And I mean, I don't need to go deep into anthropology or like serious literature around this, but if you see 70s, 80s, 90s Bollywood, there's this sort of tangential and comical reference to pagalo ka doctor hai, dimag ka doctor hai. But now we see that changing, and that is what I mean by acceptance, both in seeking it as well as in providing it. Um, and who better a symbol of that than Dr. Bhatt, who has done so much in the state in terms of generating more awareness and acceptance. I wanted to end with an urge that Dr. Bhatt has already started with, but I would bring it in here in any case just to also add my weight to it, is that I urge participants here, people that you might know, to please come together as a community which has representation from all aspects of life. It should not only be the onus of development workers like myself or NGOs who are active in this or practitioners like Dr. Bhatt. We should have parents, and I'm very happy to see that we have the sessions built in today as well. So, can we have parents? Can we have adolescents? Can we have young people like Nishra, Anjali? Can we have volunteer cardons, NGOs to come together to build a strategy that gives direction to this mandate and this joint commitment that we have in the state and take this forward, because everybody has a role to play. Like I said, supply, demand, and acceptance, everybody has a role to play. We come together as a society and we take this forward. And I really look forward to that happening in the state. And with that, I would want to end my address here. So, all the best for the day. And thank you for giving me the opportunity.
Thank you so much, ma'am, Sharmila, ma'am. I think the insights that you've shared has already given us a very push. You have pumped up into the aspects that, as an individual, we can take our single efforts, but as a whole community, we can always make a difference. And thank you for highlighting those points, ma'am. Followed by, we have Miss Nishra Sechpal. Miss Nishra Sechpal is a law student at GLS Ahmedabad and a strong advocate for mental health. Through her experiences with mental health and therapy, she hopes to inspire more and more young voices to seek the right kind of help for the mental well being. Ms. Nishara, I would really like you to share out your certain insights on this, and then we'll be beginning with the with the first workshop. Thank you.
Thank you so much, Anjali. I have to say it's such an honor to be on this panel, to be recognized as somebody who's worthy enough to speak here with all of these esteemed panelists, and it's just such an honor. And thank you so much. Talking about mental health in the pandemic, there are so many various things that I have to say. Obviously, as Sharmila said, acceptance comes first. Anybody who is going through mental health issues or mental disorders or is experiencing any sort of trouble with their emotional, sociological, or psychological well-being, that comes in the category of mental health, and that is very important for welfare as well as well-being of the whole country as well. Youth, adolescents, they form the foundation of a country, and if we are going through mental health problems, it is very important to consider that as doing something for the welfare of the country. Now, during the pandemic, there were so many issues that adolescents and young people had to face, because it is not necessary that the safe space of individuals is always at home. There were so many people that I personally know who had to go through so much emotional or physical abuse at home, obviously along with all of the other problems like setbacks and staying at home, loneliness, all of that. One of the main problems that I saw was the abuse that people had to go through. Psychologists and seeking out therapy is obviously very important, but not every household is going to be extremely supportive of it. I am very lucky that my parents and my family has been very accepting of mental health disorders or seeking therapy, but not everybody has. There's a distribution of the kinds of experiences that people have had. One of the categories would be people like me who have been very vocal about it and whose parents have been very accepting of it. The other category would be of people who do accept therapy, but they always come with those little taunts or those little subtexts that are there in the air. Okay, ठीक है तुम जा रहे हो थेरेपी के लिए, फाइन, यू नो तुम कब ठीक होने वाले हो, ये पूरा पागलपन है, ऑल ऑफ दोस दे ऑब्वियसली एक्सेप्ट इट, लाइक ठीक है तुम जाओ थेरेपी के लिए, बट बिकॉज समथिंग इज रियली रॉन्ग विद यू, गो एंड फिक्स इट. That is one of the categories of the of what people have to go through. And one of the most serious and heartbreaking things that I've seen is that people who are going through real very serious mental health problems have to have stayed at home for that long in lockdown, um, in the whole COVID time period. They had to stay at home, endure all of those mental health problems without any sort of help from therapy or psychologists or any of those infrastructure that is set up for mental health, or without any of the support from their own family members or any of the acceptance. They just had to be there, severely emotionally abused, and had to go through that because a lot of the times the escape that young people have from their non-accepting backgrounds is going out, focusing on their lives outside of home. And with that entire arena is just cropped out because of COVID, and you have to stay home for all that long while, and you don't have a safe space to go to, which is not in your own house. It becomes extremely difficult for anybody to have or even have a shot at good mental health, balanced mental health, or at least a shot at trying to seek therapy which can increase or which can improve your mental health. Um, Especially during COVID when everybody is going through already so much other stuff, dealing with passing away of family members or loved ones, and having setbacks in educational systems, or missing out on internships or exams or studying, all of those things everybody is going through. When people are going through tough things, what you can do is you can be there for them. You Physical touch plays a very important thing there. You hug somebody, you make them feel okay, you know. And during COVID, you cannot show people that you cannot be there for somebody, and for you, people can't actually be there for you. There's no physical touch, there's no significant way for somebody to make you feel like there is somebody else with you and you're not alone in this, and that takes a toll on somebody's mental health. I know obviously everybody has tried so hard to surpass this, and to be there online, be there virtually with all the hi, can you hear me, am I audible, but it still takes a toll on somebody when you can't there is no physical touch. It is very important, and especially for adolescents and young people, because there is a statistic that 70% of the mental disorders have their onset before the age of 25, and that is such an eye opener in understanding that there is such an important essential window in adolescence to have treated that, or to have an intervention in that, to give solutions for that, or to help with that. That the most important window is adolescence, and when they are not treated, or when they're not addressed, these issues are not addressed, it becomes a whole problem, not just for people that we're going to be as adolescents, but for the people that we are going to bring or we are going to raise, because this is the foundation for a whole generation. And when this is not given any importance to, or when this is not accepted, or when this is a taboo, when it is not understood by the people that we're around, it's just heartbreaking. There's no coming back from that. We can try after we're grown up, but this is such an important stage which has to be given importance to and has to be understood. There's no other way around it. So there has to be some very aggressive follow up to bringing integration among jurisdictions, various jurisdictions like schools, education, health, justice, all of those different things. When they come together and give some importance and acceptance to mental health, that's when it is going to be put forward, it is going to go forward. Yes, I think that is all that I have to say. Thank you so
Thank
much.
you. So much, Ms. Nishra Sejpal. I think I take forward the pointers of, understanding that we all face through various facets of mental health and realizing the fact that we need really solid proof policies, rules, and regulations to bring social well-being into schools and universities, where it's very, very important for each and every one of us to inculcate that into our curriculum as well. Thank you so much for your wonderful insights. I'd like to really thank each and everyone on the panel and the speaker list, and also our dear participants who have joined in here. I can see the children's, I can see the parents also joining in. So I'd like to give a brief thank to Dr. Nishchal Bhatt, to Ms. Nishra Sejpal, to Dr. Sravan Chenji, and Ms. Sharmila Ray for flagging off this inaugural event for us and sharing their beautiful, beautiful insights and work that has been done in the field of mental health via UNICEF, via their own individual actions, and via being involved into most and most different organization, governmental, non-governmental, and so on. Thank you so much, each and everyone. We are now going to be beginning in the next session. So I request each and everyone to end this platform and to begin with the next session, which is the Hum Tum session. And thank you so much for joining in, sir. Everyone.
Thank you.